Welcome to this brief review of workforce wellness and safety for EMTs. In this video, we'll cover key concepts and practices to help ensure your safety and well-being on the job. While this overview provides valuable insights, it does not include all the information you need to know. Be sure to refer to your textbook and course materials for a more comprehensive understanding. Remember, as an EMT, your health and safety are just as important as the care you provide to your patients. Let's dive in. To take care of others, we must take care of ourselves. Recognition of hazards to your health, safety, and well-being is important. Personal neglect, environmental and human-made threats, and mental and physical stress. The emotional well-being of the EMT and the patient are intertwined, especially in high-stress rescues. Health is a complex interaction between physical, mental, and emotional connections. Chronic physical, mental, or emotional stresses can worsen or increase the chance for developing health conditions. Not all reactions to stress are negative. Eustress creates a positive response. Examples of eustress include increased focus, increased energy in the short term, and increased job satisfaction and self-image in the long term. Distress causes a negative stress response. Wellness is the active pursuit of a state of good health. Resilience is the capacity of an individual to cope with and recover from distress. The following practices can help increase resilience. Eat a healthy and well-balanced diet. Ensure a minimum of 7 to 9 hours of sleep per day. Strengthen positive relationships with close family and friends. Build relationships with peers and colleagues. Incorporate daily stretching, movement, and exercise. Lastly, build habits of mindfulness and positivity. Stress management refers to tactics that have been shown to alleviate or eliminate stress reactions. Strategies to manage stress include minimize or eliminate stressors as much as possible. Change partners to avoid a negative or hostile personality. Change work hours. Change the work environment. Cut back on overtime. Change your attitude about the stressor. Talk about your feelings with people you trust. Seek professional counseling if needed. Do not obsess over frustrating situations that you are unable to change, such as relapsing alcoholics and nursing home transfers. Focus on delivering high-quality care. Try to adopt a relaxed, philosophical outlook. Expand your social support system beyond your coworkers. Develop friends and interests outside emergency services. Lastly, limit intake of caffeine, alcohol, and tobacco use. To maintain workforce wellness, it's important to eat regular, well-balanced meals. Limit your consumption of sugar, fats, sodium, and alcohol to promote overall health. When it comes to energy, complex carbohydrates, such as pasta, rice, and vegetables, are excellent long-term sources of fuel. While fats can also be converted to energy, consuming too much fat can lead to obesity, cardiac disease, and other serious long-term health issues. Staying hydrated is equally essential. Adequate fluid intake, especially water, is the best way to fuel your body throughout the day. Lastly, the USDA's My Plate icon reminds us to emphasize healthy portions of vegetables, fruits, grains, proteins, and dairy as part of a balanced diet. An infectious disease is caused by harmful organisms that enter and affect the body. A communicable disease, however, can spread either from person to person or even from one species to another. To reduce infection risks, EMTs should focus on 3 key practices. Staying up to date with immunizations, using proper protective techniques, and practicing regular and effective hand washing. Let's also go over some important terminology. A pathogen is a microorganism capable of causing disease in a susceptible host. Contamination refers to the presence of pathogens on surfaces like dressings, water, food, or even on a patient's body. Exposure occurs when you come into contact with blood, body fluids, tissues, or airborne particles, which could allow disease transmission. Finally, personal protective equipment (PPE), like gloves, masks, and gowns, is essential for preventing exposure to pathogens or other hazardous conditions. Always remember, taking these precautions is critical to protecting yourself and your patients. Next, let's talk about the routes of transmission, or the ways infectious diseases can spread. Understanding these routes is critical to protecting yourself and others. Direct contact involves person-to-person transmission, such as exposure to blood-borne pathogens through bodily fluids. Indirect contact occurs when pathogens are spread through objects, like needle sticks or contaminated surfaces. Airborne transmission happens when infectious agents are spread through the air, for example, by sneezing or coughing. Foodborne transmission results from consuming contaminated food or beverages. Vector-borne transmission involves the spread of disease through insects or animals, like fleas or mosquitoes. Recognizing these routes allows you to take appropriate precautions to minimize your risk of exposure. To reduce the risk of infectious and communicable diseases, it's essential to follow established guidelines and precautions. The Occupational Safety and Health Administration, or OSHA, develops, publishes, and enforces standards to help reduce workplace hazards, including exposure to infections. All EMTs are trained in handling blood-borne pathogens to ensure they can protect themselves and others from contamination. The Centers for Disease Control and Prevention, or CDC, has also established standard precautions for healthcare workers. These precautions are protective measures designed to prevent contact with objects, blood, body fluids, and other risks that may lead to exposure to germs. Since 2016, the CDC recommends assuming that every person could be infected or capable of spreading infectious organisms. To minimize risk, always apply proper infection control procedures. Remember that OSHA's universal precautions align with these same principles. Finally, if you believe you've been exposed, it's critical to notify your designated officer immediately to initiate proper post-exposure management. When caring for critically ill or injured patients, communication is key to building trust and providing effective care. The first step is to ensure the patient knows who you are and what you are doing. Calmly introduce yourself and explain your role. Let the patient know that you are focused on attending to their immediate needs and helping them through the situation. This simple reassurance can help reduce their anxiety and establish confidence in your care. Communicating effectively with critically ill or injured patients is essential for providing compassionate care and minimizing their stress. Here are some key techniques. Avoid sad or grim comments. Negative remarks about the patient's condition can increase anxiety or hinder recovery, so focus on calm and supportive communication. Orient the patient to their surroundings. Help them feel grounded by explaining where they are and what's happening. Be honest. Share information in a way they can understand and accept. Involve them in their care when possible, giving them a sense of control and partnership. Allow for hope. Even if there's only a slight chance for a positive outcome, express that hope to provide comfort and reassurance. Additionally, it's important to locate and notify family members. Assure the patient that you will take care of informing their loved ones, which can help alleviate some of their worry. Caring for injured or critically ill children requires sensitivity and understanding. Children should be cared for with the same professionalism and medical expertise as adults, ensuring their needs are met with compassion. Whenever possible, a family member or responsible adult should accompany the child to help alleviate anxiety and assist in their care. In the tragic event of a child's death, it is important to acknowledge the profound difficulty of the situation. The death of a child is one of the most heartbreaking experiences for both families and responders. During this time, your role is to support the family, offering compassion and understanding as they navigate the initial period of grief. Death and dying can occur in two primary ways. Sometimes it happens quite suddenly, without warning, while other times it follows a prolonged, terminal illness, allowing more time for preparation and acceptance. The grieving process is often described in 5 stages: denial, anger, and hostility, bargaining, depression, and acceptance. It's important to understand that these stages don't always happen in order. Individuals may experience them at different times, revisit the same stage more than once, or even skip some stages entirely. Grief is a personal and unique experience for everyone. As an EMT, there are several things you can do to support a patient and their family during difficult times. First, ask if there's anything you can do to help. Reinforce the reality of the situation while being honest and sincere. Avoid saying you know how they feel, as everyone's experience is unique. Most importantly, allow the patient or their family members to grieve in their own way and at their own pace. Stress management is crucial in the field of EMS, as it is a high-stress job. Understanding the causes of stress and how to manage it is key to maintaining your well-being. Stressors can come from emotional, physical, or environmental situations. The body's response to stress is known as the general adaptation syndrome, which occurs in 3 phases. First, the alarm response to stress. Second, the reaction and resistance phase, where the body tries to adapt. And finally, recovery, or if stress is prolonged, exhaustion. Learning to recognize and address these stages is essential for staying healthy on the job. Stress can cause a variety of physiologic responses in the body. These include increased respirations and heart rate, elevated blood pressure, and dilated venous vessels near the skin surface, which can lead to cool, clammy skin. Pupils may dilate, muscles tense up, and blood glucose levels rise to provide energy. You may also notice increased perspiration and decreased blood flow to the gastrointestinal tract, which can disrupt normal digestion. These are all natural responses as the body prepares to handle stress. Post-traumatic stress disorder, or PTSD, may develop after someone experiences a psychologically distressing event. It's often characterized by re-experiencing the event and overreacting to stimuli that trigger memories of it. To help providers manage stress, critical incident stress management, or CISM, is commonly used. CISM can be formal or take place at an ongoing scene, facilitated by trained professionals. Defusing sessions occur during or immediately after an event, while debriefing sessions are held 24 to 72 hours later. It's important to remember that debriefing sessions should never turn into operational critiques. If CISM isn't available, private counseling with a mental health professional may be a better alternative for stress relief. Burnout is a state of exhaustion, cynicism, and reduced performance caused by long-term job stress. It not only impacts the well-being of the EMT, but also affects colleagues and patients. Burnout can lead to serious consequences, including increased major medical errors, higher rates of healthcare-associated infections, and even increased patient mortality. Additionally, burnout contributes to lower work morale, reduced overall effort, ineffective teamwork, and decreased patient satisfaction. Over time, it can also result in higher job turnover, making it a significant challenge for both individuals and the EMS profession as a whole. Compassion fatigue, also known as secondary stress disorder, is a common issue among healthcare providers. It is characterized by a gradual lessening of compassion over time, often as a result of prolonged exposure to emotionally demanding situations. Symptoms of compassion fatigue can include high absenteeism, difficult relationships with colleagues, and an inability to work effectively in teams. Providers may exhibit aggressive behavior toward patients, strong negative attitudes toward work, and a lack of empathy or judgmental attitudes toward those they care for. Additionally, they may become preoccupied with non-work issues while on duty and show other signs of increased stress. Recognizing these symptoms early is essential to address and prevent further impacts on both providers and patients. Emergency responders face a higher suicide rate compared to the general population. This is largely attributed to the intense job stress that comes with the profession. It's important to recognize that help is available. Several organizations and mental health services provide emotional support specifically for emergency responders. Seeking help and addressing stress early can make a significant difference in preventing such tragedies. Workplace issues, such as cultural diversity, are important to understand and navigate in EMS. You will work alongside coworkers from various backgrounds, attitudes, beliefs, and values, and it's essential to respect and accept these differences. Culture is not limited to nationality. It also includes factors like age, disability, sex, sexual orientation, marital status, work experience, and education. Communicating in a way that is sensitive to everyone's needs helps foster a positive work environment. Your ultimate goal should be cultural humility, remaining curious about others and continuously reflecting on your own viewpoints with an open mind. This approach promotes understanding, teamwork, and respect in a diverse workplace. Sexual harassment in the workplace is any unwelcome sexual advance, request for sexual favors, or verbal or physical conduct of a sexual nature. This can occur when submission is a condition of employment, influences employment decisions, or creates a hostile work environment by interfering with performance. There are two main types of sexual harassment. Quid pro quo. This occurs when the harasser requests sexual favors in exchange for something else, such as a promotion. Hostile work environment. This includes behaviors like inappropriate jokes, unwanted touching, leering, repeated requests for dates, or comments about body parts. It's important to understand that the harasser's intent does not matter. What matters is how the behavior is perceived and the impact it has on others. In public safety professions like EMS, where coworkers rely on each other for safety, maintaining respectful, non-adversarial relationships is critical. If you experience or witness harassment, report it to your supervisor immediately. Substance abuse in the workplace poses serious risks, especially in EMS. It increases the chances of accidents, creates tension among coworkers, and can lead to poor treatment decisions, putting patient safety at risk. To address this, many EMS systems require periodic random drug testing, as well as for-cause testing if there's reason to believe someone is under the influence of alcohol or drugs. If you or a coworker is struggling with substance abuse, it's important to seek help or find a way to address the issue. Ignoring it can create a tremendous hazard to the public. Many workplaces offer employee assistance programs or EAPs, which provide support and resources to help overcome these challenges. Injury and illness prevention is a critical part of ensuring EMS providers' safety on the job. Every year, EMS providers visit emergency departments more than 20,000 times for work-related injuries and exposures. To reduce these risks, injury and illness prevention programs should include 6 key elements. Management leadership. Ensuring safety is a priority led from the top. Worker participation. Involving employees in identifying and addressing safety concerns. Hazard identification and assessment. Recognizing risks before they cause harm. Hazard prevention and control. Implementing measures to eliminate or minimize hazards. Education and training. Providing knowledge and skills to work safely. Program evaluation and improvement. Regularly reviewing and enhancing the program to ensure effectiveness. By combining these elements, EMS systems can better protect providers from injuries and illnesses while on the job.